Welcome back. So you're looking to really get a handle on the money side of healthcare. Smart move.
It's definitely a complex area.
Yeah, it really is. Today we're going to try and cut through some of that complexity, tackle those core economic questions you sent in.
Our aim really is to give you the essentials, how the money works, from these big global systems right down to, your own access to care.
And it's fascinating, isn't it? Healthcare feels so fundamental, so human.
It absolutely is. But the way different societies pay for it, deliver it, well, that
Uh,
creates these incredibly varied economic pictures.
right. Some systems just consume enormous chunks of national wealth.
Exactly. So let's start there, maybe, with those different systems you mentioned.
Good idea. How do they actually differ across the world? It's not just minor tweaks, is it?
Oh, not at all. You've got places where the government is basically the main payer, the main provider.
The single-payer model we hear about.
That's one type, yeah. Then you have systems that lean much more heavily on private insurance, market competition, that sort of thing.
And a key difference is how they handle risk.
Absolutely. How do you pool that risk? Is the cost spread across everyone, maybe through taxes? Or does it fall more on individuals, based on their situation, their premiums? Big difference in philosophy and economics.
Okay. And thinking about a country's whole economy, just how big a slice is healthcare spending?
It's massive. I mean, truly significant. For a lot of developed countries, you're looking at maybe 10 to 20% of their entire GDP.
Wow,
What?
20%. That's huge.
It is. That affects everything. Jobs, innovation, even how competitive a country is globally.
And is more spending always better?
Well, that's the interesting part. Some countries spend way less per person, but get similar, sometimes even better, health outcomes.
So efficiency really matters.
It's critical, which
Okay.
kind of leads us to health insurance, doesn't it?
It does. Seems obvious it affects access, but can you unpack the economic side of having it or not having it?
Sure. Think of insurance as a buffer.
Yeah.
It protects you from those potentially catastrophic medical bills.
Right, the ones that can bankrupt people.
Exactly. Without that buffer, people are, well, more likely to put off seeing a doctor or skip treatment altogether.
Which sounds like a bad idea health-wise.
It is, and paradoxically, it can end up costing the whole system more later when treatable problems become serious emergencies. Access gets tied directly to your bank account.
Okay, let's look ahead a bit. Populations are getting older in many parts of the world. What does that mean economically for healthcare?
That's a really big challenge looming. An older population generally needs more health care.
More chronic conditions, long-term care.
Precisely. And that puts a huge strain on the budget because you have more people needing care compared to the number of working people paying into the system, however that system is funded.
Yeah, that math seems tricky. Now, we can't really discuss costs without bringing up pharmaceutical companies.
True, they play a major role.
What's their main influence on the economics here?
Well, developing new drugs, new treatments, that's vital, obviously, but it's incredibly expensive.
The R&D costs we hear about.
Right. And patents give them exclusive rights for a time, letting them set prices. Those prices can be a major driver of overall healthcare spending.
So it's a balancing act.
Always. You want to incentivize that innovation, but you also need treatments to be affordable. It's a constant tension.
And that ties into the whole private versus public debate, doesn't it? That seems like a constant argument.
It really does. The economic arguments on each side are pretty distinct.
What are the main points?
Well, supporters of private systems often talk about efficiency, maybe more consumer choice, responsiveness.
Okay, and the public side.
They tend to focus on universal access, equity. The idea that healthcare is more of a fundamental right, not just another product to buy and sell.
And each has different trade-offs. Cost, access, quality.
Exactly. There's no single perfect model. They all involve balancing different priorities.
So if costs just keep rising in whatever system a country has, what's the risk to the nation's finances?
Yeah.
Like national debt?
Oh, it can definitely be a major driver of national debt if it's not managed. Governments have to find that money somewhere.
Meaning less money for other things.
Mm.
Or higher taxes.
Potentially, yes. It becomes a serious long-term fiscal headache if costs spiral upwards unsustainably.
But it's not hopeless.
Yeah.
Are there ways to control those costs? What about, stopping people from getting sick in the first place? Preventative care.
Absolutely.
Yeah.
That's a key area. Investing in prevention, things like vaccinations, health screenings, public health campaigns can pay off hugely.
How so economically?
Because you prevent illnesses entirely, or you catch them really early when they're much less expensive to treat.
So it saves money down the road.
Big time. and obviously improves people's lives, which is the main point. But the economic savings are real and significant.
We saw healthcare systems under immense stress recently with the pandemic.
We certainly did.
How do crises like that shake up healthcare economics?
Well, they just expose every vulnerability, don't they? Hospital capacity, supply chains for medicines or equipment, everything gets tested.
And the cost must be immense.
Huge, unexpected costs for testing, treatments, developing vaccines incredibly quickly. It really slammed home the connection between being prepared for public health crises and having a stable economy.
So wrapping this all together, is there a solid economic argument for just investing more consistently in public health?
A very strong one. Think of it this way. Investing in public health is really an investment in the economy itself.
Because healthy people are more productive.
Exactly. A healthier population works more, misses fewer days, uses less expensive acute care down the line. Plus, it makes the whole country more resilient to future shocks, like another pandemic.
Right. So it's all interconnected. The system design, the spending, insurance, aging, pharma, public health. It all weaves together economically.
It really does.
Okay, here's something for you, the listener, to think about. Considering all these forces we've touched on, these economic pressures, what single change, what one shift do you believe would make the biggest positive difference for both healthcare access and affordability?
Yeah, that's a tough one. No easy answers there.
Definitely something to chew on. Thanks for joining us for this deep dive.